Hi friends, today we have a very important topic on our agenda, glaucoma. I'm sure many of you have heard of this disease, but let's go into more detail and learn more. Glaucoma is a chronic eye disease characterized by increased intraocular pressure, development of optic neuropathy, and impaired visual function. Clinically, glaucoma manifests as narrowing of the visual fields, pain, sharpness and heaviness in the eyes, blurred vision, deterioration of twilight vision, and, in severe cases, blindness. Glaucoma is one of the most dangerous eye diseases leading to vision loss. According to available data, approximately 3% of the population suffers from glaucoma, and glaucoma has been the cause of blindness in 15% of blind people worldwide. People over the age of 40 are at risk of developing glaucoma, but ophthalmology also encounters forms of the disease such as juvenile and congenital glaucoma. The pathogenetic mechanism of glaucoma is associated with impaired outflow of intraocular fluid, which plays a key role in the metabolism of all eye structures and maintaining a normal intraocular pressure. Normally, the aqueous humor produced accumulates in the posterior chamber of the eye, located behind the iris. 85% of the intraocular fluid flows through the pupil into the anterior chamber of the eye, the space between the iris and the cornea. Outflow of intraocular fluid is provided by a special drainage system of the eye located in the angle of the anterior chamber. From there, the intraocular fluid drains into the scleral veins. To maintain normal intraocular pressure, a balance between the outflow and inflow of aqueous humor is necessary. In glaucoma, this balance is disturbed, resulting in the accumulation of excess intraocular fluid in the eye's cavity, accompanied by an increase in intraocular pressure above the tolerant level. High intraocular pressure, in turn, leads to hypoxia and ischemia of eye tissues. There are primary and secondary forms of glaucoma. Primary glaucoma can be classified as closed-angle glaucoma or open-angle glaucoma. In closed-angle glaucoma, there is an internal blockage in the eye's drainage system, while in open-angle glaucoma, the angle of the anterior chamber is open, but the outflow of intraocular fluid is impaired. The clinical course of open-angle glaucoma is usually asymptomatic. Narrowing of the visual field develops gradually, sometimes progressing over several years, so patients often accidentally discover that they can only see with one eye. Occasionally, patients may complain of blurry vision, presence of halos around lights, headaches and brow ache, and decreased vision in darkness. Both eyes are usually affected in open-angle glaucoma. An acute attack of closed-angle glaucoma is caused by complete closure of the angle of the anterior chamber of the eye. Intraocular pressure can reach 80 mm of mercury or higher during an attack. The attack may be triggered by stress, fatigue, pharmacologically dilating the pupil, prolonged darkness, or prolonged work with a lowered head. During a glaucoma attack, there is severe eye pain, sudden vision loss, and redness. The attack may also be accompanied by nausea and vomiting, dizziness, chest pain, pain beneath the shoulder blade, and abdominal pain. The eye feels hardened on palpation. An acute attack of closed-angle glaucoma is an emergency condition and requires immediate reduction of intraocular pressure through medical or surgical means within a few hours. Otherwise, the patient may face irreversible vision loss. Early detection of glaucoma is of prognostic importance, as it determines the effectiveness of treatment and the state of visual function. The determination of intraocular pressure, detailed examination of the fundus and optic disc, visual field testing, and examination of the angle of the anterior chamber of the eye play a crucial role in the diagnosis of glaucoma. A more precise qualitative and quantitative analysis of structural changes in the optic disc and retina is performed using laser scanning ophthalmoscopy and optical coherence tomography. There are three main approaches to treating glaucoma: conservative, medication-based, surgical, and laser. The choice of treatment strategy is determined by the type of glaucoma. There are numerous methods of laser surgery for glaucoma. They vary based on the type of laser used: argon, neodymium, diode. Laser iridotomy and iridectomy, laser iridoplasty, laser trabeculoplasty, and laser goniopuncture have gained wide popularity in glaucoma laser surgery. In severe cases of glaucoma, laser cyclocoagulation may be performed. Anti-glaucoma surgeries have not lost their relevance in ophthalmology. Among the fistulizing, penetrating surgeries for glaucoma, trabeculectomy and trabeculotomy are the most common. Non-fistulizing interventions include non-penetrating deep sclerectomy. It is important to understand that it is not possible to fully cure glaucoma, but this condition can be kept under control. Satisfactory functional results in glaucoma treatment can be achieved at an early stage of the disease, before irreversible changes occur. Uncontrolled progression of glaucoma leads to irreversible vision loss. Glaucoma prevention includes regular eye examinations by an ophthalmologist for individuals at risk, such as those with somatic and ophthalmic conditions, a family history of glaucoma, and those over 40 years old. Patients with glaucoma should be under the supervision of an ophthalmologist, visiting the specialist every 3 months and receiving the recommended treatment lifelong. Thank you for spending time on our channel. If you have any additional questions or comments, please feel free to ask them in the comments below. Take care of your vision, and we'll see you soon on our channel.